Hi, this is Dr. Monroe, and I'm back with your weekly chiropractic health and wellness update. This week, we're not going to be reviewing an article from our doctor's resource page, but we're going to be discussing a current event that can have an impact on your next visit to your family physician. Here's what happened. There were some new guidelines that came out to help determine whether someone's risk of developing a cardiovascular disease and whether they should be on certain type of medications and if they should be on a medication even as a preventative measure. Now, if you look at the guidelines, they really haven't changed from what the general risk factors. They still look at what your overall lifestyle is, whether you're exercising and if you're eating fatty foods or a lot of starchy foods or food with high fructose corn syrup. Weight plays a major role in those risk factors, as well as family history, male or female, smoker versus a non-smoker, whether you're diabetic or whether you maybe have a high systolic blood pressure. Now, there always was the factor of what your total cholesterol was. But here's what I think they've done. They've taken that cholesterol number and they've sort of broken it down to the relationship with your a history of cardiovascular disease, a family history of cardiovascular disease, what your LDL levels are relative to those two things that I just mentioned, your LDL levels as to what, and as if you were a diabetic, or LDL levels if there was a family history of diabetes, and they put these into an equation to determine whether you would be a candidate for someone who should be on a statin medication, even on a preventative measure. See, here's the problem I have with that. Because there's so many diabetics, and LDL cholesterol is purely a function of the amount of carbohydrates and starches that you tend to consume. The number of people who could potentially be put on statin medication is going to grow exponentially. Some experts believe that these new guidelines could put as many as 1/3 of all Americans on a statin medication. I'm telling you this for you to be aware, because they're basically the things that they want to give you a medicine for are lifestyle choices that you can make, changes you can make in your lifestyle so that you don't have to be on a medication for the rest of your life and potentially suffer some unintended consequences as a result of being on that medication. Now, there was a really good indicator that did come out of this that I believe, and that was they talked about the importance of having a C-reactive protein test. Now, I've talked about that test numerous times, and it's a measure of inflammation in your body. And I personally believe that that's one of the strongest indicators as to whether you would develop cardiovascular disease or maybe any other chronic disease that's out there. So I think that's actually a very important finding. Here's the thing. I need you to be ready and I need you to be informed and advised, because this is something you may be facing during your next appointment with your doctor. So look, if you're someone who's looking for ways to decrease your risk of developing cardiovascular disease, why don't you stop into the office, make an appointment. We'll be glad to guide you and put you down that path so you can start to have a more fulfilling life and live a life of health and wellness. The patients who've done it, they've been really glad that they've done it. So again, if that's something you're looking for, give us a call at the office. I'm going to keep you posted because I know there's going to be a lot of information that rolls out as this comes out. So again, just pay attention, and I hope you keep watching our videos as we continue to post them. Oh, one more thing. We're having a health and wellness class on November 20th at the Mustard Seed. The title is going to be The Consequences of Stress, and it will be at 6:30 in the evening. All you need to do to attend is to just call our office at 614-879-5070 and reserve your seat. Now, just come on down, relax. We're going to cover your coffee, tea, and snack, just so you can have an hour to relax. And if you have any good questions, we're glad to answer any questions you may have. So, again, thanks for spending some time with me. I hope to see you at our class. And if you don't think you can make it to the class, refer a friend. Tell them to come to the class. It's great information. So, I look forward to bringing you another video blog next week. Thank you for spending some time with me.